Here we are resuming the review of lab values. Statins are the drugs which reduces or decreases low density lipoproteins. Dactylitis is swelling of hands and feet in babies in sickle cell anemia. And splenic sequestration crisis is something which we can see in sickle cell potential life-threatening emergency. So we'll read it like this. Splenic sequestration crisis is the potential life-threatening emergency in sickle cell anemia. And as you all know, Lyme disease, it is infected by D. tick, infected with Borrelia burgdorferi. And chest tube drainage greater than 100 ml per hour, immediately report to HCP. Hematocrit, so it's different with female and male, so I can remember like this. So hematocrit is equal to 3 into hemoglobin. So if you consider in that way, 39, if 13 is the normal value, 13 to 17 is the normal value of hemoglobin for male, so 13 into 3 is equal to 39. So if you can't remember the values or the percentages of hematocrit, so 39% to 50% is in male and 35 to 47% in female. And platelets, the normal value is 150,000 to 400,000 mmq. WBC, so in U world it says 4,000 to 10,000, and in some other books like it says 5,000 to 10,000. And next one is BNP, brain natriuretic peptide. This is the peptide which will be produced in the heart failure patients. It is produced by the heart muscle which has been infected, and greater than so we can see this BNP greater than, the normal value is like greater than 100 pg per ml. So, and we will see this BNP increased in the patients with heart failure. And as I have read before, hematocrit is 3 into Hgb, that is hemoglobin, and hemoglobin is the normal value of hemoglobin in males 13.2 to 17.3, and females 11.7 to 15.5. And central venous pressure normal value 2 to 8 mmHg. MAP, mean arterial pressure, it is 70 to 105 mmHg. And in case of anaphylactic shock, I have written somewhere, in case of anaphylactic shock, this mean arterial pressure should be greater than 65 mmHg. So we should, as a nurse, we should maintain it to be greater than 65 mmHg. And systemic vascular resistance is 800 to 1200 dynes per dynes. Then I wrote some meds here. Proton pump inhibitors ends with Prazole. Obtundation, if you see the word obtundation, we have to remember that it is a sign of severe hypoglycemia. And these are the pulmonary auscultation findings. So on percussion, we can see hyperresonance in two conditions, that is pneumothorax and emphysema. On auscultation, we can have hyperresonance on percussion in the pulmonary auscultation findings, and in rheumatoid arthritis we see dullness on percussion. Next, consolidation, that is lobar pneumonia. We observe increased breath sounds and increased tactile fremitus. So this is a large table, so I have just minimized in this way. And if we see in pulmonary auscultation findings, increased breath sounds and increased tactile fremitus is only found in consolidation, that is lobar pneumonia, and rest all other pulmonary diseases we find decreased breath sounds and decreased tactile fremitus. Rest all decreased breath sounds, or we can say absent breath sounds. And so this is about pulmonary auscultation findings. Spleen rupture is a serious complication of mononucleosis. So if we see the condition mononucleosis, which is an infectious disease, so a serious complication we can see with this condition is spleen rupture. Normal PaCO2, partial pressure of carbon dioxide, is 35 to 45 mmHg. Partial pressure of oxygen should be greater than 80 mmHg. And creatinine kinase normal value is greater than 15,000 units per liter. So this creatinine kinase will be released when there is severe muscle damage, and this will be a precursor to the kidney injury. So nurse's responsibility is prompt IV fluids. We have to give the IV fluids immediately. So the normal value is creatinine kinase should be greater than 15,000 units per liter. And this is criteria for initiating rapid response team. Heart rate less than 40 or greater than 130. Systolic blood pressure less than 90. If respiratory rate is less than 8 or greater than 28. Oxygen less than 90% despite oxygenation, and urine output less than 50 ml per 4 hours. And we also should see level of consciousness. And one more criteria for rapid response team is if any physician or if any staff member is concerned or confused about the patient's condition, we can initiate rapid response team. Norepinephrine is a vasopressor which increases stroke volume, cardiac output, and also mean arterial pressure, as I have reviewed previously. So in this situation, MAP should be greater than, we should maintain MAP greater than 65 mmHg should be maintained in case of septic or anaphylactic shock. And normal pulmonary artery wedge pressure is 6 to 12 mmHg. And this is the scribblings done by my son. Okay. So amphetamines are the drugs which we call it as CNS stimulants or mood altering drugs. So this can be legally given to patients suffering with ADHD, that is attention deficit hypertensive disorder, and narcolepsy. And this drug also can be addictive if used illegally. It can be an addictive drug as well.